So we talked about the herbal therapies, and secondly, we mentioned some dietary changes or dietary recommendations. So these are the two things that we talked about in treating gallstones, and these are the two major things that we talk about in treating any kind of disease. That is the herbal therapies or the herbal procedures and some dietary recommendation. Because when you read Proverbs, a very common verse, you get to learn that there is no curse that can come to us as the human race without a cause. And mostly diseases are caused by poor diet or bad diet. And so herbal therapies would help the body to quicken healing. And the dietary recommendations will help you not to get that particular disease again, or not to put yourself in a condition in which you will have the disease. We'll read the history of healing, page 127, to understand that as we continue when we'll be introducing the topic diseases. So, what are some of the things we mentioned concerning the treatments of gallstone? So, number one are the herbal therapies. So, what are some of the herbal therapies that we mentioned? Under herbal therapies, we mentioned a specific formula, a specific procedure that normally really helps. And the procedure is called a liver flush. A liver flush. Flushing simply means to clean, or to irrigate using a liquid. And so, under herbal therapies, the main treatment that we talked about is a liver flush. And what is a liver flush? So we said that a liver flush could be fasting. A liver flush simply means fasting. And how is this fast supposed to be done? What are some of the liquids that we can use to help facilitate or flush the liver? We mentioned that in the fast should be between 7 to 14 days. The fast should be between 7 to 14 days depending on the patient. So the duration will depend on the patient. And in our liver flush, what we mentioned is in day 1 and day 2, the patient ought to fast. The patient ought to fast on lemon juice, on day 1 and 2. Fast on lemon juice on day 3 to day 14, or probably welcome Silas. On day 3 to day 14, probably day 10 or day 5, depending on the patient should fast on these two things. And I'll write to us. I believe that we all have books and probably are taking notes. So this is how your patient will fast from day 3 to 14. The patient, these are the requirements these days. Let me first write the requirements. Your patient will need some apples, olive oil. Number 3, a particular fat called lecithin. And if you can't find lecithin, you don't have to use it. And then number 4, you need lots of lemons. Lots of lemon. And so how are we to do this particular cleanse with these things? So let me give you guys an example. I'll use a different pen. This probably green. So when the patient wakes up at 8 a.m., you can give them some apple juice to drink. At 10 a.m., give them apple juice. At 12 a.m., give them apple juice. At 2 p.m., this one here should not be p.m. but noon, at 12 noon. At 2 p.m., give them some apple juice again to check. At 4 p.m., give them apple juice. At 6 p.m., give them again some apple juice. Apple juice. So this is what you'll do on the first day. This is what you'll do on the first day of the 3 to 14 days. My pen is misbehaving. 3 to 14 days. My pen is misbehaving. So this is the first day of this particular day. Yeah. The 3 to 14 days. So that would mean day 3 of the fasting, because day 1 and day 2 got to fast on lemon juice alone, and the lemon juice should be diluted in some water. The second day will be the same as the first day. Let me, to avoid confusion, allow me just write here day 3. So this is the third day stroke the fourth day. Do this one for the third day, fourth day. And then on the fifth day, you can do the same thing. You can do these protocol again, but at 7, let me use a different pen for this day. That is the 5th. You can use the same procedure as the 3rd and the 4th day, but at 7 a.m., give them olive oil plus lemon juice. And then just before they go to bed at 7 p.m., do the same. Give them olive oil plus lemon juice. And so you'll rotate these for 14 days. So when beginning the 6th day, begin again with the 1 with the 2 days fast in lemon, and then get back to the 3rd and the 4th day, and then get to the 5th day. But if they're to do it only for 1 week, that would mean you do the lemon and the lemon juice fast on day 1 and 2, and then on day 3 and day 4, you'll do this one on day 3 and day 4. You'll do this one on day 3 and day 4, and then finally the final day, the only thing that you do is this one, and then get them back to their food. But when getting them back to their food, you continue giving them olive plus lemon juice, and this you'll continue doing twice a day. So what quantities of lemon and olive should you give your patient? Giving them olive oil of 250 ml plus 250 ml of lemon juice. They should be equal. So does anyone have a question or probably something, a point of clarification? Is there someone who wants to ask a question or needs something to be clarified before? Yes, Mpofu. Yes, Mpofu, you can kindly just unmute and raise the concern. Hello, hello, hello.
Yes, I was saying, can you please elaborate from the 6th to the
From the 6th day to the 14th day. From the 6th to the 14th.
yes, from the 6th to the 14th?
Okay. So we mentioned on day 1 and 2, you ought to fast on lemon water alone. On day 3 and 4, you ought to fast on apple juice and you ought to take the apple juice You ought to take the apple juice after every 2 hours, from 8 to 6 p.m. From 8 a.m. to 6 p.m. And then on day 5, on day 5 and 6, and day 7, so that it can become a week. Um, so that's day 5. So on these days, day 5, 6, and 7, you ought to do what you did on day 3 and 4. But what you did was take apple juice between 8 to 6 p.m. for every 2 hours, after every 2 hours. So on day 5 and 6 and 7, you'll do the same thing, that is taking apple juice from 8 to 6 p.m. But in addition, in addition to that, in addition to that, um, take olive oil. In addition to that, take olive oil mixed with 100 ml of lemon juice. So in addition to that, you take olive oil to 50 ml or lemon juice 100 ml or to 50 ml. Taking to 50 ml is better as compared to taking 100 ml. So this is what you do for the first week. And then the second week, that is now day 8 and 9. On day 8 and 9, you'll do the same thing you did on day 1 and 2. You'll do the same thing you did on day 1 and 2. On day 10 and 11, you'll do the same thing you did on day 3 and 4. And then on day 11, 12, 13, and 14, you'll do the same thing you did on day 5, 6, and 7. So if your patient cannot fast all the way to the 14th day, you can just leave and stop it where they'll get tired. If it's on day 2, you just leave and stop it there, but you continue giving them olive oil and lemon juice twice in a day. Olive oil and lemon juice twice in a day. This one here. This one here is very, very essential for gallstones. For gallstones. And this is where when they're not able to fast this way from day 1 to day 14, you'll have to give them this one. You'll have to give them this one here. These two twice in a day. Twice in a day, alongside the normal food, and ensure that the food is 80% raw. The largest amount of food they eat should be salads, vegetable salad or fruit salad either. We'll talk about salads in a few, or we'll talk about the dietary recommendations in a few. I believe that was elaborate enough to answer the question. So, on dietary recommendations, we mentioned a few things. That is sugar and fats. We mentioned a few things, sugar and fats. And under sugar, we mentioned anything that is highly processed. And we talked about the normal sugar um, that we use in our teas to make our teas, which is not healthy. And then industrial sugar. An example is glutamate. So we mentioned these sugars should be avoided. And then the other thing that we mentioned that should be avoided is trans fats are found in your vegetable fat. Any vegetable fat has trans fat. Secondly, we mentioned milk and its products. We mentioned flesh, any kind of flesh, white or red. We as well mentioned deep fried foods. Anything that is not part of this, the patient can freely take. The patient can freely take. And in these ones, there is a type of fat called saturated fats in milk and flesh. And so, what these will do, saturated fats will increase the bad cholesterol levels in your system, in the blood. And what will happen? The stones will be formed more, and that's why you ought to avoid them. The sugars will increase the levels of triglyceride in your blood, and when triglyceride levels are increased, I said triglycerides are a certain kind of fat in the blood, and when triglyceride levels are increased, stress hormone called cortisol is increased, which lowers your body's immunity. When triglyceride levels are increased, the bad cholesterol as well are increased, and so you ought to avoid all these when you have gallstones, or rather, when you have a patient that has gallstones, they ought to avoid all these. And then lastly, So as I was saying lastly, we have how should their food or their menu plan, how should it be? They should eat 80%, the largest chunk of their food should be raw foods, because raw foods will actually help the system. The best way to detoxify is fasting on raw vegetables and raw fruits. That's the best way to detoxify your system when you have any kind of disease. And when you do this, your immunity will be increased, and a lot of heat will be removed from the body. We'll see all that when I'm talking about nutrition. So 80% should be raw and 20% should be cooked. And the raw foods should be in form of salads. Probably some of us have had the salads, probably some of us have not. But we'll talk about and we'll see salads. So at this particular point, just know that the raw foods should be in form of salad. The cooked foods are the normal cooked foods that we know, and they should be cooked in a way that is becoming of a Christian. And so we'll proceed to our next topic, unless there's a question. So I want us to study today about hepatitis. I want us to study about hepatitis today. And Mpofu, I see your hand is still raised. Is there any question? So this red organ here is your liver. Is your liver. Can somebody kindly remind us where exactly is the liver located in the abdomen? Can somebody just kindly unmute and remind us where it is located in the abdomen? Yes, Asnet.
At the right side of abdomen, right side,
The right upper side of the,
the
yeah, the right upper side of the
upper
abdomen.
side of the abdomen,
Yeah. So I believe
just below the ribs.
yes, thank you. I believe we are well familiar now with this particular picture. We've seen it several. So the liver is present in two sections. The abdomen can be divided into 9 sections, as we had seen, and the liver is largely present in the right
Right side of
hypochondriac region, the right hypochondriac region that is here. But there is some part of it that is in the epigastric part, and then there is some part in the right lumbar region, the region that is just directly opposite to the umbilical cord, the nerve, and I believe you know that organ. So directly beside it, so the liver is an organ, and this is how it is. This is how it is. Just trying to draw. That's how it is in our stomach, or in our abdomen, not stomach. So I want us to see some of the functions of the liver, just as brief. This is how it looks like in just the liver is the gallbladder that is responsible for releasing bile for emulsification of fats, and emulsification simply it means um breaking down fats into small soluble compounds. Fats are normally broken down the simplest. the simplest compounds into which fats are broken down are lipids. So this one here is your stomach. This one here is the stomach, all of it. This is the stomach. Let me draw its borders. Let me draw the borders of the stomach using green. I believe you can see the borders of the stomach. And some part of the stomach is just behind um, the liver. And then we have this one here as the gallbladder. This one here is the gallbladder. That's the gallbladder. And then the pancreas that is just directly behind the pancreas. And then we also have the spleen, which is directly behind our stomach. So the pancreas and the spleen, they are closer to the back. They are closer to the back as compared to our stomachs. And so this is just a simple diagram to show biliary system. Biliary system is a combination of your liver and the body. So the liver is the largest internal and diverse metabolic. Metabolic simply it means breakdown, mechanical breakdown, mechanical breakdown of substance. I'm writing things which are not seen. So metabolic is mechanical, not really mechanical, but chemical breakdown of substances. So the liver is the largest internal and diverse metabolically complicated organ in the human. Anything, anything that is absorbed in the digestive system from the small intestine going downward, it must pass through the liver for it to be further um, digested or transformed. What are some of the functions of the liver? Number one, we see the production of bile, which happens in the gallbladder. That's what happens in the production of bile, which happens in the gallbladder. We see the production of albumin protein. Albumin is a protein that binds up with it binds up the red blood cells when red cells rupture, and so it is responsible for removing ruptured dead red blood cells from our body, albumin. And we have it produces cholesterol. 70% of the cholesterol in our body is produced or manufactured in the liver, and that's the amount of cholesterol that we need. All the cholesterol that we need in our system is manufactured in the liver. The nerves need cholesterol, the cells need cholesterol, and so 70% of it is manufactured by the liver, and 30% is orally ingested into our body. There are plant sources of cholesterol, and there are plant sources of cholesterol, and there are also the plant sources of cholesterol are they are pro. They are not the exact cholesterol, but they are pro. They can lead to the formation. They can stimulate the liver to produce more cholesterol, but cholesterol itself is normally found in animal products. In animal products like milk, flesh, and such like. So the liver produces cholesterol. The liver is responsible for storage of glucose as glycogen. So the other responsibility of the liver is storage. Storage of what? Glucose. And the glucose is stored in a different form. That's as glycogen. And so when you are fasting, then it's the glycogen that is used or metabolized into glucose so that your cells can make up energy when fasting. And when the glucogen is over, the body normally resolves to metabolize fats for energy. And so there's also this one, convert ammonia to urea. Converts ammonia to urea. Converts ammonia to urea. So ammonia is a waste substance, and for it to be removed from the system, from our bodies, it ought to be converted first to urea. It's an end product of digestion. It's an end product of digesting some foods. And then secondly is in the storage of iron. So there's a lot of iron in the liver, and iron normally is used in making blood. That's why um, conventionally the quickest way you would be told to get iron is to eat a liver. Why? Because iron is stored in the liver, and the iron that are in animal in flesh foods, they are normally available. They are more bioavailable. What I mean by bioavailability, they are easily um, they are easily absorbed into the system. They are fast absorbed into the system compared to plant iron, the ions that are in plants. Then lastly, the clearance of bilirubin, which normally is in the blood, clearance of bilirubin. So these functions, they actually help us to know whether there's a problem with the liver or whether there's a problem somewhere through a test called the liver function test. You can always know by just testing your blood. Testing these things in your blood, you can clearly know if there's a problem with your liver, if there's a problem with a particular system in your body. But that one we'll study when the time comes, so don't worry about it. So we've said it removes potentially toxic byproducts of certain medications. That one. And uh, you'll go through the slides and read those. So we talked about uh, biotransformation that is through metabolism, where ammonia is biotransformed into urea, hemoglobin, the drugs, the synbiotics, and the glucose. They are normally transformed into other forms in the liver. And then storage, there are vitamins that are stored there in the liver, there are glycogen stored in the liver. There are fats stored in the liver, vitamins, glycogen, lipids, or fats. And then the third function of the liver that is synthesis or processing or production. There are growth factors that are processed, albumin and urea through the biotransformation of ammonia. So this is the same thing that we mentioned in the other slide. So the liver can be diseased. The liver can be diseased. And what are some of the diseases of the liver? Can have viral diseases of the liver, which normally is hepatitis. Hepa, hepat simply mean liver. Itis, can someone remind us what itis mean? We talked about it. It means inflammation. It means inflammation. So hepatitis simply it means the inflammation of the liver. And this particular inflammation, mostly it's caused by a virus. It's caused by a virus. So we have three types of hepatitis: A, hepatitis B, and hepatitis C. They are all viral infections. infections, and they are sexually transmitted. They can be sexually transmitted, and they can as well be transmitted through body fluids. Mostly hepatitis B can be simply transmitted through body fluids. And there are other diseases of the liver, diseases caused by drugs, poisoning, poisons, or too much alcohol. And examples are a fatty liver and cirrhosis. Liver cirrhosis mostly is caused by, it can be caused by poisons, liver cirrhosis. It can be caused by poison, so it can be caused by too much drinking, excessive drinking of alcohol. And then we have liver cancer as another disease of the liver. And then we have inherited diseases as these ones. Hemochromatosis and Wilson's disease. So those are the common liver diseases that we have, and we speak about them and see how they can be treated. Probably you've heard of someone who has hepatitis, or probably heard of someone who has a liver cancer. We've dealt with liver cancers a lot, So I wanted us to see hepatitis and some of the harms. I wanted us to see hepatitis. So hepatitis, as I said, is an inflammation of the liver, which comes as a result of alcohol consumption. Several health conditions and some medication can also cause this particular condition, that's hepatitis. And we have these classes of hepatitis or types of hepatitis, but commonly we have A and C hepatitis. And mostly people are normally vaccinized, or the children are normally given hepatitis vaccination when they're still young. So it's a condition that is very little heard of. I have a patient with hepatitis currently. And so what are some of the symptoms? So it's a condition that is little heard of either way, but it's there. It's there. So what are some of the symptoms? Abdominal pain, back pain, um, fever joint pain. Actually, she has a lot of fever joint pains, which has gone to already. It has, mm, I believe most of us know osteoarthritis. It's a type of arthritis that is generation of genes. So the symptoms are abdominal pain, dark urine, or joint pains, and then we have loss of appetite, at nausea and vomiting, weakness and fatigue, yellowing of the skin, which is called, the medical term for that is jaundice, and whites of the eyes. So this is the medical term for the yellowing of the skin, yellowing of the eye, and the eyes can at times be white. So, and these are some of the symptoms. But the best way to be sure that a patient is suffering from hepatitis is doing some blood work, doing liver function test will help tell best. But these are the symptoms. And helping someone with um, hepatitis, in helping someone with hepatitis, tell us how. I'll tell us how. I'll tell us how. So number one, there's a list of herbs that I'll mention that helps with hepatitis. I'll mention a list of herbs that helps with hepatitis. So I'll first mention the herbs, and then immediately after mentioning the herbs, I'll mention immediately after mentioning the herbs, mention the dietary recommendation. Like anyone who has a liver disease should not take fried foods, alcohol, alcohol, or fats and sugar. So number one is grapeseed extract. The patient should take 3 capsules times 4 times a day. In Kenya, olive leaf extract is a bit rare, but you can find them. Olive leaf extracts. The patient can take 2 capsules times 4. And then we have garlic. If you're doing the odorless garlic, it's the one in capsules. The patient should take 3 times 3 capsules in a day. So these are list of medication which your patient should use. And then number 4, we have oregano. Oregano, oregano oil. Let me write essential oil. Oregano essential oil, very powerful antiviral. Around 2 to 3 drops. You can take this one 2 times in a day. You can put drops in a drinking water 2 times in a day. And then, secondly, the most powerful herb for the liver is milk thistle. Where are we? Number 5. We have milk thistle. You can steep. This one there is no overdose actually. In milk thistle there is no overdose. Someone can use it simply for even 4 years. Around 1000 milligrams daily. You can use 3100 milligrams daily for 4 years without any side effects. So it's a very powerful herb, this one. So you'll steep 5 tablespoons. We've talked about this separately. You'll steep 5 tablespoons in just 2 liters of water. 2 liters of water, and then you use that 4 times in a day. And sixth, we have I'll just list these other ones. We have garlic, which is also very good. Another powerful food we have which is a very powerful herb for infections. And then which other herb should I mention? St. John's wort, very powerful. the central nervous system, and for viruses. I believe I've written vegan. There's one oil that I'm forgetting that you should as well use. There's one oil, black seed. Yes, I remember. Black seed oil, very, very powerful. Actually, when you have a cold or flu, take 3 tablespoons of black seed oil, 3 times in a day. For 5 days, the flu will be gone. It's very powerful for viruses. Black seed oil. Black seed oil. You ought to take black seed oil for uh, um, let's say 3 tablespoons. If it's hepatitis, do this 4 times in a day. 3 tablespoons 4 times in a day for black seed oil. So these are a list of herbs that you can use, and we'll talk about and we'll see when studying natural remedies how we can make formulas for particular diseases like hepatitis. How we can use these herbs that I've listed here and mix them and make formulas or drugs to target a particular condition, if it's arthritis, if it's diabetes, hypertension, or whatever disease. We will see that when um, talking about natural remedies. But these are deeply covered in level 2 of our training. This is level 1. Level 2 is 2 months. Level 1 is 4 months. So we'll deeply see this. But when you have the first four herbs that I mentioned, these ones, and this one as the fifth, and the 10th one that is black seed oil, you're just good to go for hepatitis. You just need to treat your patient for 3 months and they'll be free of that virus if that's God's will for them. If it's God's will for them. So about liver conditions, we said that alcohol should be avoided, high fat foods, that is flesh and all that, avoided. You should avoid caffeine, anything toxic and poisonous to the system should be avoided and should not be used at all. Any highly refined products, highly refined, anything that has less fiber or is deprived of its parent fiber, example, white wheat flour, white rice, potato chips, not really potato chips, but we'll see them in when studying nutrition. Highly refined products, when you're writing just straight highly products and highly processed products should be avoided whatsoever. And then for liver patients, be it cancer or any liver disease, just ensure that they are fasting on, like not really fasting, but taking a majority, the largest chunk of their food should be raw foods. That is salads, should be salads. 80% raw, 20% cooked salads. And that will really work best in detoxifying the system, mobilizing your immunity cells, or rather strengthening your immunity cells, and focusing more of the energy to healing your particular malady. And so that's just all about hepatitis. That's just all about hepatitis, but there is still more that we cover. So I beg to stop or end today's class there, unless there is a question. We've we've studied today's session. We've taken exactly 1 hour. We began at immediately 8 or 6, I believe, and we are now, and less probably there's a question. just say a closing prayer and is there any question? Okay, so probably there's no question.